Hi, my name is Jen Guertin, and I've spent nearly 2 decades in global health at the Johns Hopkins University, and I now work as the Director of Development at American University's School of International Service, which houses the Changing Aid Research Initiative to improve and inform future aid. My project centers on the role of US-based universities in global health, how they've been impacted, how they've responded, and what WomenLift North America cohort members employed at universities have learned. North America cohort members from academic institutions make up nearly 25% of all North American cohort members, and US-based universities have played a privileged, long-standing, and multifaceted role in global health work. Their involvement spans not only research, innovation, advocacy, technical assistance, and program implementation, but also capacity building, as well as policy influence. Additionally, they receive millions annually in tuition dollars to build a pipeline of global health professionals. How have changes in federal foreign aid impacted universities here in the US in 2025? First, it's important to memorialize the changes that took place. Universities working in global health overall experienced sudden halts, cancellations, and massive restrictions around awards and subcontracts. Global health work that focused on capacity building as opposed to science research was especially vulnerable. Universities faced opaque political scrutiny and reputational shock, including placement on secret blacklists that heightened anxiety and reputational harm. The new environment triggered internal reassessments at many schools, with leadership about how to organize and protect global health efforts, together with greater selectivity in where, when, if, and how to engage geographically and programmatically. Overall, some global health work continues, but much of it is altered, canceled, or in massively condensed provisional forms. What steps did universities take to mitigate the loss of federal funding? First, some universities created a temporary bridge fund or pooled funding for faculty facing paused or terminated federal awards. These funds were characterized as highly competitive and undersized relative to the need. They were short-term and applied subjectively across departments. Second, two members described school leadership engagement occurring behind the scenes, including lobbying through associations, direct engagement with policymakers in DC, and participation in coalitions and lawsuits, with one example around IDC rates. Overall, though, public messaging focused more on academic freedom and research broadly across the universities, not global health specifically. Universities focused on diversification, and that work accelerated engaging private philanthropy. Some universities, including those not in the spotlight, attempted to organize advocacy efforts. Yet these largely came from individual faculty and happened despite institutions, not because of them. One university outlined draft talking points for senior leadership on what would be permissible advocacy messages to the federal government and supported university-based coalition efforts. Overall, though, members working at universities stated advocacy's reach was limited due to fear of retaliation and reputational risk. Four important and consistent learnings were identified as well, including an over-reliance on the federal foreign assistance as a structural vulnerability in global health. Universities were not prepared for politicized funding shocks and lacked contingency plans. They also lacked transparent decision-making frameworks and mechanisms to protect people. And while institutions with large global health schools appeared more engaged, many deprioritized global health immediately, demonstrating that global health is often seen as a cost center supporter versus a strategic asset. Our time now requires a reimagined role for US-based universities, and members suggested limiting support to 3 areas: evidence generation, convening, and exclusive focus on locally led research and program delivery. Overall, universities demonstrated that when faced with the opportunities to cede power and funding, many institutions cling to legacy models. Overall, I was able to demonstrate my own professional growth in the following areas. As authentic, I was able to lean into what I value, which is personal relationships that move us towards a better community of service. I was able to represent silenced voices to foster inclusion, bearing witness within members and different cohorts that were concerned about speaking out. I was able to research how universities can step into the discomfort to utilize my strategic thinking, and I'm working on being more impactful through greater channels in leadership, including AU's Changing Aid. Thank you.